Hello, my name is Dr. Simmons-Diez, and I am your instructor for this term for Human Anatomy Lab, sections EB, EC, and ED. Lab doesn't start technically until next week, okay, on the 23rd. But I'm going to go ahead and just review a few things on the PowerPoint. I don't want this to be long and lengthy, but just so that you have some idea of how I'm setting up the course, and some points where we will need to Zoom together to do some of the exercises, but that is not, will be a normal day. For the most part, I will record probably a Zoom meeting, embed it, and you can or cannot listen to it. That is your choice, but the information is there. It will be tested, and it will be on the exams. Okay, so let's go ahead and start. I have a few things open, so I need to share my screen. Share my screen. So let's go ahead and start with the PowerPoint. Okay, so why does it do that? Okay, introduction. Let's go ahead and start with this, and I'm going to go around some things. So first aspect to talk about a little bit is lab safety, but since we are online, it is mute. Now there was a quiz for that, but I did take it off, and the only thing I left was the tag that was on the syllabus in the schedule. So, but you don't have to worry about lab safety. Lab absence policy, again, is the same thing. The attendance that I take, and I have an attendance sheet, just so that you know, and I go through, you can't see it very well, but I go through and I mark off when the assignments, not necessarily the day, but that the assignments have been completed. And this is important, especially these first 3 weeks, so that I know that you are still involved in the course, and also so that you don't get too far behind. Okay, the reasons for the lab component is just to support the lecture. It is a lot of information. So I highly recommend that you make index cards on your phone or slides on your phone, or the more you see the information, the easier it's going to be to recall when you have to. And that's repetition. And a lot of it is mostly repetition. Disabilities and accommodations. If you have a disability, please notify the Student Success Center so that Ms. Miri can inform me of what the disability is and how I need to accommodate. Okay. Now the exam dates are firm. The exams, the midterm, one midterm, and one final. Okay. Now these dates I will not change no matter what. They will require that you use lockdown browser, and Respondus Monitor. Respondus Monitor does need a webcam, so you need to invest in a webcam. Now, with the way things are, and basically that there's more and more online courses, the web camera is going to be necessary unless your own computer provides one. Okay, so let's move on. Okay, so I'm going to go into a little bit of the anatomy portion of it. So everything that is talked about in anatomy is talked about in a specific position. Okay, is what we call our anatomical position. And here we have an example of it. So I'm going to try to use the little marking pen. Let's see, the laser pointer. Okay, so as you can see, the easiest thing is that you are face forward. Okay, so facing forward, your anterior portion is facing in front. Your palms, okay, are facing forward also, or we could say the palms are up. I say it's easier to understand if you look at your thumb and you think about it as hitchhiker's thumb. Hitchhiker's thumb, hand open, the palms are out. Okay, so just remember that. And then, of course, look at your feet. Your feet are facing forward. Okay, they can be slightly apart, but anytime we make a reference to a body part, it's going to be in this position, okay? And it's important to know that now. Okay, let's see, it won't let me go forward. It won't let me go forward. Okay, so now what we're going to talk about a little bit is how we view, I want to say, the divisions of the body, or basically cuts, okay? So there's three main planes, okay, that we see different organs, okay? And you've known this because you've all had x-rays at some point in time. So they angle the camera in such a way where they can look straight down the middle. Straight down the middle is called anything that divides the right side from the left side is called sagittal. Okay, now if it's straight down the middle, that means it goes between the eyes, right in the middle of the nose and the mouth, and straight down the sternum and right in between the legs. Okay, that's mid-sagittal. Now, sagittal just means separating the right and left. So does that mean if I cut the body, separating the arm from the trunk, is that not a sagittal cut or a sagittal plane? Yes, it is. Okay, but it's no longer dead center or dead middle. Now it's off the side, okay? And we call that parasagittal. So if I made this cut here, separating the arm from the rest, you're still separating the right side from the left side, actually the left side from the right side, okay? So it's still a sagittal plane. It's just not dead center. Okay, so the other one is the opposite. The opposite is separating the top half from the bottom half. So separating the superior portion from the inferior portion. And that is called a transverse plane. So can it be anywhere? Yes, it can be. You could do a transverse plane along the shoulders, along the lungs, the area of the lungs. You could do it across the pelvic bones or the hips. Okay, you're still separating the superior portion, the top half, from the bottom half. Okay, and then the last one, which is the one that a lot of you forget, is called the frontal or coronal. Now there's two words for that. Frontal, coronal. So a crown is worn on the top of the head between the face and the back side of the skull. So that is exactly what this plane does. This plane basically draws a line separating the anterior portion from the posterior portion. Okay, so that is your frontal plane, also known as coronal plane. And the words are used interchangeably, which is why you need to be familiar with both of them. Okay, so the oblique just goes from shoulder to hip. Okay, that is really what the oblique is. But in this class, we don't use oblique very much. So just focus on frontal, coronal, transverse, and sagittal. Okay. Okay, that is those. And then we'll go to the next one. Okay, now this is just the same thing again, but this is just a reference to the head. So again, here you have your mid-sagittal between the eyes. You have, okay, there's another side right over here, which would be your parasagittal. Remember I said it doesn't have to be dead center. Then you have your transverse, which would separate the eyes from the mouth. Well, actually also the nose, okay, separating the eyes from the mouth, the nose and the mouth. And then you have your frontal, okay, separating the face from the back of the head. So that should be, okay, pretty simple. Now this you're supposed to do at home. And I wanted you to take a couple pictures to add to your assignment, to where you're going to take your pictures of the exercise review sheets, and then you add the 3 pictures of your banana. Okay, everybody has a banana. Banana's not a big deal to get, and then you're just going to cut it. Now, of course, if you don't give it a face or a body to the banana, you're not going to know what side or what end is what end. So of course, you're going to have to designate which end is going to be the top, which is going to be the bottom, and where the face is going to be, etc. And then I want you to take, you know, a clean knife and then cut it along a transverse plane, cut it along a mid-sagittal plane, and cut it along a frontal coronal plane. So that's 3 pictures. Okay. Now this one, I'm probably going to go out to show you, but just so you know, this looks like there's a lot of it you already know. And what I've done on the quiz, okay, is not put all of the terms. There is a lot of terms, okay, but what I'm asking you is to tell me what body part it is. That's what I have on the quiz. So let's look at this. So what I have is oris, and I have you matching it, and I give you all the examples. I have you matching it with mouth, okay? Now, oris or oral are the same thing, so you need to know both, okay? But the answer is still going to be mouth, okay? Then I have another one, such as antebrachium. You need to know that the antebrachium refers to the forearm, and so that's what I have. And I have palmar, okay, refers to the palm. I have, what else do I have? I have quite a few. So I have axillary in reference to the armpit, okay, bucca in reference to the cheek. So that's what I have. So you do have all these terms, not all of them, but quite a few of them. And then you have what part of the body it basically relates to, or what body part it is. Okay, now this will take a bit of time, but I'm putting you under the clock because I don't want you to have to second guess yourself. I want you to go through. So go through, and I suggest you do all the ones you know off the bat, and then go back, okay, and then look it over again a second time. That doesn't mean you can do the test or the quiz 2 times. You only have 1 time to do it. But if you do it that way, because you get all the questions at 1 time, but something might jog your memory, okay, once you've gone through it. But that's how I did this. Like the acromion, what is it? Look at what it's referring to. It's referring to the tip of the shoulder, and that's what I have. Okay, I've got dorsum, the back. Okay, cervix refers to the neck, and so forth. I've got buttocks. Okay, I have as okay gluteal, and there's a few other ones. And they're all here, as you can see. I don't use all of them, like I said, but it is a long question, okay? It is a long question. But you should be familiar with all of them. Okay, and this is just an exercise for you to do. You don't have to take a picture of it and send it, but I do suggest that you get used to looking at these specific regions. For example, you know, the femoral refers to the thigh area. Okay, this is the one that I've been asked about. How do we know when to use what? Okay, and it is true in certain circumstances. Okay, you can use things more than once. However, okay, what's important is what I'm going to tell you now. Okay, so let's look at it in parts. Okay, first of all, okay, anything that lies in the middle of the body is medial. Okay, so we have it defined as towards the body midline. So for example, okay, the heart, the sternum is a better example. The sternum lies medial, but this is always relative to something else. So it's always in reference to another position or another structure. So in this case, okay, its opposite would be lateral. Okay, and anything lateral lies away from the midline. So your clavicle, okay, which is part of the shoulder articulation, okay, it's right here. So clavicle is a bone. Okay, the sternum is another bone. So your sternum lies medial, the clavicle lies lateral. So then how do you say this? Well, you say The clavicle lies lateral to the sternum, okay? Or you could say the sternum lies medial to the clavicle, okay? But normally you have to have two structures, okay? Now, superficial and deep. What's important about superficial and deep, it has to do with layers, okay? Remember that. When we're talking about layers, what does that mean? Well, there's a lot of layers in my hand. How so? Well, if you go from the outside to the inside, how many layers do you have to get through? You have to get through the skin. You have to get through a fatty tissue layer, which is connective tissue. You have to get through muscles, tendons, probably ligaments. Then you probably have arteries, or I would say arterioles, which are smaller, but you've got veins and arteries, so you've got vessels, okay? You probably have lymph stuff also, which are another type of vessel, and you've got bone, okay? So that's a lot of layers, okay? It is a lot of layers, and that is when we use superficial versus deep. So you could say that the skin lies superficial, the bones in the hand. Okay, technically you would have a specific bone, like you would have the phalanges, which is the bones of the fingers. Okay, there's several different types, but just phalanges. Okay, or you could have the metacarpals. The metacarpals are the bones of the hand. Okay, so then you could say the metacarpals lie deep to the skin. Okay, there you go. So, we see it more so when we talk about the abdominal pelvic cavity and the thoracic cavity. So again, for example, you could say the sternum lies superficial to the lungs. There you go, layers. The lungs are deeper, okay, than, okay, the sternum. So again, layers. Now, could you use could you use medial and lateral? No. Remember, because normally what you're referring to with superficial and deep is that they're on the same plane. Okay, they're on the same level. So technically, no. What other one do we have? Okay, we've got a few other ones. We have anterior versus posterior. There's another name there, ventral versus dorsal. You need to know both of them. So practice anything on the anterior side. So you have the sternum lies anterior to the vertebral column, okay? So if something is more forward, then you use anterior. If something is more backward, towards the back, okay, then you use posterior or dorsal. Okay, another one. Okay, towards the head, which is superior, or towards the feet. So this one's kind of tricky because you have two CC words. So superior is also called cephalad, okay? And inferior is also called caudal, okay? Now, really, there may be one or two examples using cephalad and caudal, but we tend to use, in human anatomy and physiology, we tend to use more superior and inferior. So we can easily say that the shoulders are superior to the knees. The knee is inferior to the hips, okay? So again, it is which one is closer to the feet, okay? Or which one is closer to the head. And remember, they work in pairs. So it's just a matter of figuring out, okay, the structure and where it is. Okay, and so that takes care of this picture. We also have supine and prone. Supine means lying, okay, down and your belly is up. So you're lying on the table facing up. Prone is you're lying on your belly, so you're lying down, but your back is facing up. Okay, and like I said, normally supine is the anatomical position. Okay, next. Okay, this is, I just gave it to you in reference to an animal. Please note, okay, this is not on the test or quiz, But I just want you to know that we are looking at human anatomy. So we are a biped organism. Whereas with quadrupeds, notice how dorsal and superior are very different. Okay, ventral inferior are very different than cranial and anterior and caudal posterior. Okay, but that's because the cat is a quadruped. Okay, now we go on to body cavities. Now, I have a good suggestion here. I give it to you, but you could do good practice by making your own flow chart, okay? Because cavities are within cavities within more cavities. So there's a ton of subdivisions, okay? So the first subdivision is basically looking at the two big ones, which is your dorsal cavity, okay, versus your ventral cavity, okay? So your dorsal cavity is subdivided into the cranial cavity and the vertebral cavity. That's it. You're done. Dorsal is done, okay? The rest of it has to do with the ventral cavity. So then the ventral cavity is, okay, subdivided into two main parts, the thoracic cavity and the abdominal pelvic cavity. Okay, now the thoracic cavity is further subdivided into two pleura cavities and a pericardial cavity. One pericardial. Okay, there's only one heart, but there's two sections of the lung. Okay, pleura refers to lungs, pericardial refers to heart. Okay, now there is a space, the space between the two lungs, the right and left lungs, okay, has a space that contains the pericardial cavity. Okay, the pericardial cavity, okay, that space, okay, is the mediastinum. Okay, do not think of it as a cavity. It's not a cavity. It is a space. Within the space is the pericardial cavity. Okay, again, that's why I said do a flow chart. Okay, break it down, break it down, break it down. Okay, or a concept map, whatever is easiest for you. So that is our thoracic cavity. Now we have our abdominal pelvic cavity. Okay, the ventral cavity is divided into the abdominal pelvic cavity, which is further divided into three parts. Okay, you don't see the third one here, but you have the abdominal cavity, you have the pelvic cavity, but you also have the perineal cavity. Okay, and I do think I show it in the next one. Okay, yes. Okay, do I have it in this one? It's in your book. It's in the lab manual. Okay. Oh, I didn't. So this is what I was saying. This is a flow chart. Okay, and it's telling you what organs, okay, or how the cavities are developed. Okay, and what they do. I was looking for my abdominal pelvic cavity here. The abdominal cavity also contains the peritoneal cavity. And so I think I may have it on peritoneum, which is a connective tissue, and the peritoneal cavity. So there's actually three. It's abdominal cavity, pelvic cavity, and peritoneal cavity. Okay, and what it contains. Obviously, most of the organs that you know, okay, are in the ventral cavity. So, for example, the abdominal cavity contains digestive glands and organs, such as the stomach, the liver, etc. Your pelvic cavity contains the urinary bladder and the reproductive tract, okay, etc. You will need to know those. So the human body consists of 11 organ systems. You need to be able to know them, and you need to be able to say them without having to think. Okay, so it has to come out quite quickly. They are: integumentary is your skin, skeletal is your bones, muscular, as you know, skeletal muscle, nervous system, endocrine are the glands for hormones and stuff like that. Cardiovascular, think of your heart and the vessels. Lymphatic is your drainage, your sewage system. We'll talk about that. It's also the immune system. So it's two things. Okay, but don't call it immunity. Immunity is only part of the lymphatic system. Respiratory system, you know, is for breathing. Digestive for nutrients. We'll get into the functions in a second. Okay, urinary to get rid of waste, and reproductive, okay, to reproduce. So you have all of them. And what you do need to know the table, okay? And in my quiz, I ask you to match the function with the organs in the system. So you must know the organ systems. I don't give them to you. I expect you to know what organs are in the organ system and the functions they have. So let's go to the next one, if I can find it. Okay, I don't know what's going on here. Okay, so this is the table. Yes, you do need to know this information. So what did I do? I went ahead and labeled the functions. Sometimes it's easier to memorize when you know how many functions you need to know. So for example, integumentary. Integumentary has 3 functions, right? So the major component organs, okay, in this organ system consists of skin, nails, hair, cutaneous sex organs, and glands. So what are the functions? Well, the first function is it protects deeper organs from injury or bacteria or dehydration. I think you can understand that. The second function is allows excretion of salts and urea. Of course, we sweat, so we get rid of waste products. And thirdly, it helps regulate body temperature. Okay, so then on your quiz, you're going to have this 3 times, but you'll have to match this same 3. This one major component organs with each one of these functions. And I did that for all of, no, I did that for the first 4. Why? Because those are the 4 that we do. So integument, you have to do that for integument, skeletal, muscular, and nervous system. Okay, so that is matching, and that was a lot as it is. Okay, now I did choose one of these as a multiple choice question. Okay, so I chose one, and I asked you, either I asked you for, I did ask you for the which of the following is the correct function for this organ system. Okay, and that may change for the exam. The exam will be mostly multiple choice. You will have some matching, but not to the extent that you have on the quiz. Okay, let's go on to the next one. I'll show you. So here it is, just more pictures. I mean, you have it, like I said, focus on those first 4 for sure. And then the other ones, know an overview, okay? Because the overview, you're going to get a multiple choice. But the first 4 will be every one of them, because those are the ones that we're going to cover, okay, in class. Okay, so the last thing that we have is basically knowing your organs, okay? You need to know what is what. And the more you learn it, the better. The more you practice it, the better. And I can give you tons of pictures if you want. Learn the organs on sight. So yes, that's the brain, okay? This is pointing to the thyroid gland, okay? This is actually Adam's apple. This is actually the thyroid cartilage, okay? That blue thing right there, okay? Notice that you have tons of arteries and veins going up to the head. Yes, you don't need to know the names just yet, but you do have quite a few. You have this blue thing right there. It's a little difficult to see, but that's actually your trachea. It's your windpipe, okay? And then coming up, you have the big aorta, and then you have the heart right here. You have the lungs. This one is just cut in half. Okay, actually, it's cut with a frontal coronal plane, separating the anterior portion from the posterior portion. I'm talking about the lung. Okay, know which side is what. Okay, if you put this mannequin in anatomical position, is this where my highlight is? That a right lung or left lung? Okay, notice where the heart is indented into it. Okay, it's the left lung. Okay, anatomy is like, I want to say, and learning anatomy is like learning to go home. When you drive home, Do you need to look at a map? No. Why not? Because you have learned to, you have learned specific structures, okay, by heart. Oh, that's not the word I'm trying to say. And honestly, I cannot remember. It'll come to me. Anyways, I'm sorry. It's not coming. Okay, so going back to that. Anyways, you do need to know the main organs by heart. Now, the thoracic cavity is separated from abdominal pelvic cavity by a muscle, big, large, flat muscle, which is called your diaphragm. Okay, this brown thing right here is your liver. Okay, and right underneath it, you see this little green sacky thing. That is your gallbladder. Okay, your gallbladder produces bile. Okay, you should know what each structure does, but you'll get into that when you go into the organ systems. Okay, right now we're just learning the fundamentals. Okay, below the liver, on the left side, you have your stomach. Again, remember, know what side is what. Okay, so left side, stomach. Now we come down to this yellow thing. Okay, so remember I said that there's a peritoneal cavity with a peritoneum. This yellow connective tissue is the peritoneum, okay? And it's just connective tissue that protects and you could say protects the abdominal, the viscera, which is the abdominal pelvic organs from the actual wall, the muscular wall, okay? Right now, what do we have? We have this large gray thing is the large intestine, and then it's followed by the small intestine. And that's pretty much all you can see here. However, please Google a few things, okay? What is not shown here are your salivary glands, okay? Your parotid salivary gland is a big gland. It looks very bubbly, just like this, the thyroid gland, very similar, but it's located right underneath, okay, the ear. There's my ear. Right here is the parotid salivary gland, okay? Now, it, of course, is underneath all the tissue, but it's important, okay? The other two salivary glands are located underneath the jaw, underneath the mandible. There's one right underneath the tongue. The tongue is the lingual, so it's the sublingual, so under the tongue, okay, is the salivary gland. And then you have one a little bit below and further back, which is underneath the mandible, which is submandibular, okay, salivary gland, okay? Now, giving me one word as an answer is not good enough, okay? It is called parotid salivary gland. You must give me all terms, okay? The same thing with the sublingual salivary gland or the submandibular salivary gland, okay? So start now. Get used to specify what the structure is. If it's a right, then you tell me it's a right. If it's a left, you tell me it's a left, okay? If it has more than one word, you give me the full word, okay? That is very important, and the sooner you develop that habit, the better it's going to be later on. And that is it, and I just hope I did not take too much time. Okay, yes, you had a little opening here that you can use or not. This is up to you. You don't have to upload it. It says the brain, and it's just asking you to which organ system it belongs to. So it's a good practice. You could just do it on a sheet of paper. Okay, again, for practice. Okay, you do have something similar in your exercise review sheets. Okay, and you have two of them. So, and then there's this one. This one we're not doing because we're not in the lab. So don't worry about it. You can omit it. Okay, I just want you to do the two assignments. So you have to do both the exercise review sheets for both 1 and 2 because we've combined them. And then you have to do the quiz. There's one quiz. Now, I was going to show you, I was going to share, I wonder if, can I share this? I'm not certain if you'll see that. I don't think you're going to see it that way. Let me stop sharing this. I think I have to go back out to go back in. Okay. Okay, so I was going to show you how I did this. So this was the one thing I told you that I have for matching. Again, it's from a different version of our book, okay? But it is in your book and you have practice. Left eye to left ear, what would you use? Okay, a thumb to little finger, what would you use? So you have it here. And so what I've done is I've given you the example and asked you to tell me what would be the term that would you use for reference. Okay, so that is one. So I think I can stop sharing with that one. And then I can go to the other one. This one. Okay, so here you have it. See? So I've gone down the line and I've said the integumentary system. These are the component organs that I need to know. And there's 3 main functions that I want you to know. Okay, and I've done that with skeletal. Skeletal has 4 main functions. Muscular, 2 main functions. It's a little bit big because it has quite a bit there in the example. But all I did was ask you to match the organs, okay, component organs with their function. Okay, I think there's one more thing to share. Let's see if I can do that. Share now. Oh, yes. So as I said, okay, by now you should have had, well, you may not have, but you should go through my introduction. Okay, remember there is no safety quiz, okay? But there is a syllabus quiz and there is a practice quiz for familiarizing yourself with the lockdown browser. Okay, that is important because it will take you about 15 minutes to set it up, maybe 10, okay, if you've done it before, okay? We've got the syllabus and the first graded event, okay? So this is just my syllabus, and then you have the syllabus quiz, which most of you have taken already. Yes, there was a few mishaps on there, and I'm, like I said in my email, for whatever reason, okay, some of the additions that I made were not being respected, were not being carried through, okay, on Canvas. It was kind of odd. Anyways, and then your contract. I need your contract, okay, before the last day to add, okay, which last day to add is the 20th. That's tomorrow. Okay, so I need those contracts in. I'm going to send an email out right now. Okay, contracts in. Lab practicals, okay, right now there's no points because I take them from what we've done, okay? Like I said, there will be more multiple choice, so do not expect only what's on the quiz, okay? Not only what's on the quiz. And there's only 2, and those do require, okay, those do require the lockdown browser and responders monitor. The language of anatomy, organ systems overview. Okay, so here's your PowerPoint. I've already done it, so I'm going to add a recorded. I'll probably just put it as an addition if you want it recorded or not, Zoom. There's the lab manual. You have the whole thing. For those of you who don't have your book, your text, so it's all there. Lab exercises, okay. That is for the first exercise 1, okay, of the lab manual, but we do 2, okay, for this module. And then you have the lab exercise, the older edition, it doesn't matter, it's the same information, it's just not as pretty, okay. And then you have the review sheets for it. For some reason, I didn't put review sheets in the first exercise, but they're still the same. Those review sheets, I am very picky about this. You do them, okay, you take a picture of each picture, okay, of each page, and then you create one document on Microsoft Word and you insert those pictures. Make sure they're big enough so I can see them. I must be able to read your answers, okay? If you want to upload it as a PDF, you can, but I prefer that you just take the pictures and you put all the pictures, including your banana pictures, into one document, okay? And then I'll grade it through. Now, the grading for these review sheets, I use a rubric, okay? So does that mean I grade every single question? No, okay? But I do look for quality and correctness and completeness, okay? And then, only then, do I release my answers, okay? Then it's up to you to check that you did indeed, and you are confident that you did answer it correctly, okay? So, but you can, it shouldn't be that difficult to get all the points, okay? You might have to look a few things up. If you have to, Google it. Most of it comes straight from the exercise lab manual, okay? And that's it. And then when you've done both of them, they are due on the same day as the quiz, okay? The quiz, like I said, the quiz is under pressure. You're not going to have time to think. You're going to have to know, okay, what goes where. I might have to look at that a little bit further. But here is the one site. All of them will be named the same. Human Anatomy and Physiology 1 Laboratory, Lab 1 upload site. That is for your exercise, your document, your Word document that contains the exercise review sheets for 1 and 2. Okay. And then just a word, when we get to graphing, this will be different. This exercise you're going to have to do, it's a handout, and I'll have questions for you. I'll have the quiz out ahead of time, probably this weekend, but it would be better if we could do it as a class. So I will set up a meeting time for all of us to log in, okay, into Zoom, so that we could go through it as a class. It's just going to be easier that way. But I'll have that out today or tomorrow. Okay, and that is it. We are pretty much done. Everything is here. I can't think of anything else. There is no, it's just all this way. This is the way it's going to come out. So you shouldn't have anything else. Any questions, email me. I get back to you as soon as I can. Okay, if you're still not clear on something, shoot me an email. I've got plenty of additional exercises for you to practice on. You can choose what you want, and I can, as long as I see that you've done something, I can give you the answers. Okay, and that's it. So we're going to stop sharing, and I will see you in a bit.